So good morning, everyone, and welcome to the February 2018 ACIP meeting. It is my great honor to use the Stanley Plotkin gavel to open this meeting. We need one of those things.
We need a and then the next will be the vote.
But first, questions. Are there questions for Dr. Schilly? Yes, Dr. Walter.
Yes, and maybe you can comment or someone else. You mentioned the post-marketing safety studies. Is there any description of what those are to be?
Can you repeat that question? I'm sorry.
It's really regarding post-marketing safety surveillance and studies. What has been agreed to, or can you comment?
You know, the FDA has worked with Dynavax on the post-marketing surveillance studies, and I will probably let either FDA or someone from Dynavax answer the questions on what the intention of those post-marketing studies entails.
Yes, there are a number of post-marketing safety studies. One, which was a requirement because in the large safety trial, the study 23, a signal of acute myocardial infarction was seen, and therefore we made it a requirement for this signal to be investigated further, and it's going to be done within the context of a Kaiser Permanente non-randomized study. The other one, which is a commitment, the difference between requirement and commitment is that perhaps related to the level of concern for the safety signal. The commitment was to look at also the occurrence of zoster because that was also seeing an increased incidence in the study 23.
Thank you. Other questions? Yes, Dr. Belongia.
Just a quick follow-up on the previous one, then I have a question. I assume there'll be a vaccine safety data link study as well looking at this. Typically there are when there are new vaccines licensed. My question, though, is related to the 1018 adjuvant, and I'm wondering, is this adjuvant used in other licensed products either in the U.S. or elsewhere, or is it a new adjuvant?
This is the first vaccine for humans in which this adjuvant is being used.
Thank you.
With the number of adjuvanted vaccines now available, including flu vaccine and Shingrix, is there any comment on using this vaccine at the same time with other adjuvanted vaccines?
We have no data to make a recommendation one way or the other.
So just to sort of put this in context of other vaccines, while preclinical studies were not done using these vaccines simultaneously, our general approach to immunizations is that they can be given at the same time in different limbs.
Yes, so, Dr. Riley.
It's okay. Do you have any data on different race, ethnicity populations with this vaccine?
Actually, that was one of the initial comments by FDA, is that some of the early phase 3 trials did not include racially diverse groups of subjects, and as a result, the Sablin study, which Dr. Harris talked about previously, that was predominantly among Asian persons. So it's my understanding that the manufacturer addressed the FDA concerns about the lack of a diverse racial subject population.
We will take a vote on this recommendation.
Yeah, voting is open now.
Thank you very much. So the voting is completed, and it is unanimous to support this recommendation. Thank you all.
And does anybody around the table, we don't need to go around and verify our votes, but does anybody have any comments they wish to make about their vote? Dr.
Great.
Stevens?
So just a slight reservation. I think this is a huge advance and a step forward. I am concerned about that signal, that myocardial infarction signal. I am concerned about the use of this new adjuvant and certainly urge us to continue to look at the post-marketing data carefully.
Dr. Hunter?
Just a question about that. How soon would we be getting that post-marketing data update here?
Dr. Ward?
There's two kinds of data. The vaccine safety data link data will require people to be using the vaccine to develop substantive database.